Hi everyone, you are welcome back to my channel. This is Nurse Bola, where we talk about nursing, health, beauty and vlog. If you are new on this channel, kindly subscribe to join the family. And if you're a returning subscriber, you're welcome back. You're welcome back to the channel. Today we're talking about how do you know that nursing is actually for you. So I discovered that everyone want to be a nurse. Everyone want to practice as a nurse. And I have been receiving different questions, different inquiries from friends, and they also want to be a nurse. They want to be a nurse. They want to practice in the States. So I'm just gonna put this saying a brief story about myself. I became a nurse from Africa. I was able to run through the journey of being a nurse. So when I was younger, I used to we have this condition called malaria in Nigeria. Because I am AA, it is very easy for me when I have little exposure to mosquitoes. I do have malaria. So anytime I got bitten by a mosquito, I get malaria, and every time I tend to visit the hospital. Every time I tend to seek for medical care for my malaria. So most times when they take me to the hospital, most times if they take me to like a state hospital, like the reception is not really good. But if they take me to a private hospital, we receive quick and adequate care immediately. So I used to feel, when you're sick, you need a quick intervention, and you are laying there, somebody is just deciding whether they will take care of you or not. I used to feel so bad. So then as I was growing up, I kept looking at the nurses in the private hospital. I kept looking at how they do, how they treat me, and I was like, I had this in my mind. I was like, no, I think I really want to take care of people. I think if I become a nurse, I should be better in taking care of lives, in taking care of people's health and helping them to attain good healthy balance. So I had that motion, that belief since when I was young, and luckily there was one of my auntie that was a nurse then. I used to visit her, so I do like the way she dressed up cute, So that time I used to feel, oh no, I think I'm gonna be a nurse. I think I want to be a nurse. So before that, actually, I noticed that my kind of person, I don't get scared about, oh, maybe anybody tell me, oh, I'm not feeling good. I tend to do some of my little care for the person. And most times I notice that when we're doing this hide and seek play when we are younger, I love playing the role of a medical doctor or a nurse. And do you know something? When I was in my high school and elementary school, I joined the Red Cross, and also I joined the health team. Like we used to have like a club, health club in my as I was going to elementary school and high school. So to be said, so I actually had the passion for it even before I actually went to school to study nursing. So by the time I was filling up my course to enter a university, I already knew I was gonna study nursing. So I wasn't even picking any course of study. I wasn't picking anything lesser than nursing, and behold, lo and behold, I eventually got it. So how do you know that you can actually be a nurse? How do you know that, oh, if life is placed in your hands, you will not be freaked out, you will be able to take care of the person? First thing you notice about yourself is that you like to care for people. You like to, when people are not feeling good, there's this way you care for them in a unique manner. So you have to, it is inbuilt. Like people say, nursing is a calling, and indeed it's actually a calling. You just see it's like you have it inside of you to be able to take care of people very well. And secondly, you're not scared of blood, you're not scared of dead people, you're not scared of seeing people in pain, though it is your duty to relieve them of the pain and the suffering they are into. So you're not scared of that. There's a way you approach it. You know something, and that's another story. Like when we in school, the first clinical posting I had a friend that was taking care of a patient, and the patient was actually speaking to her. Eventually the patient passed away, and my friend was right beside the patient. Do you know that my friend fainted, and we were resuscitating the patient and my classmates, like my friend, so there are things that you do that there's this confidence that come with it. So you're not scared of when you see blood splashes. You're not scared of that. When you see people in pain, there's this desire to relieve them of their pain. And also, how do you know? The third point I'm gonna say is that you have to be very committed and well educated to know what you're doing. So when you're going for the class, this is the time you have to put in everything. You have to put in every of your time, every of your resources, because this is about life. This is about life. The learning can be a little bit tough, can be a little bit elongated, a little bit. The learning can be tedious sometimes, but it requires optimum time so that you can understand the skills and the knowledge behind nursing. Next point, how do you know that you can actually be a nurse? When you see people going through one thing or the other, you put yourself in that person's position. You don't say, oh, okay, because you are not judgmental. You don't say, okay, because this patient has been on drugs, that's why he has heart attack. No, I'm not going to take care of the person because I don't believe in taking some hard drugs. So you might feel because this person has done this, I'm not going to take care of the person. If a nurse is non-judgmental, like you take care of patients as if you are in their shoe, as if, oh, if I am the one that is sick, how do I want people to take care of me? Have this empathy on patients. How do you know that you can be a nurse? How do you know that you can be a nurse? You like to offer service to people. You like to help people. You like to provide adequate help to people. Next point we'll be looking at is, how can you manage the stress? Well, nothing is stressful. From day one of your classes to the time you'll be practicing, it is very stressful. So are you the type that is able to handle stress? Are you the type that is able to manage and multitask? Because it will require so many things. It will require your time. It will require every damn thing. So are you the type that is able to manage stress? Are you the type that gets burned out easily? So you have to watch it. We have to look into that before you apply into nursing. And also, some other point I'm going to be talking about is that nursing is very competitive. It's very competitive. You have a set of people who are so intelligent, who are so brilliant, and they will be moving stuff for you. If you are not on top of your game, if you don't know what you're doing, you will look like a dumb man. You will be looking as if no. Sometimes you might start blaming yourself. Oh, why did I even go into this? So it is a very, very competitive profession that you see people always having solution to things. People always having solution, always having a very good idea to people's health and effectively managing people's condition. So you have to be on top of your game when you are planning to go into nursing. And also, a point I'm gonna be talking about is who is your mentor. So before I enter nursing school, I had a mentor. I had someone I was looking up to. Okay, because I see this person doing privately good in this profession. That was really a motivating factor for me. Most especially, I seek for advice from her. I seek for counseling from her. So you have to have someone you are looking up to. So you see this person doing good in the profession. You want to do better than the person. So you are watching the footstep of someone before going into it. Those there are some people that go into nursing without any mentor, without mentorship, but it is really very advisable you have a mentor before going into, because sometimes you might feel maybe don't want to further more, or you are kind of disturbed about the program and you need some clarification. You can easily go to your mentor to seek more clarification and advice. So I hope that you thinking it through. I hope you thinking whatever decision you want to make, whatever thing you want to look into, whatever course you are thinking of applying into. Everyone, before you go into nursing, think it twice, and you will surely be able to achieve it when you have the necessary background before even applying. Thank you, and I'm gonna see you guys in my next video. If you are not subscribed, kindly click on the subscribe button, so whenever I upload any video you will be able to see it, and click on the notification so you won't miss any of my video. Thank you. Bye.